functional medicine extremists. Every single person who comes in, they're going to do the same labs on everyone. This isn't the same initial $300 worth of labs to get a good initial picture and then decide how to progress from there. No, these are the people who say, I went to courses and I think a lot of the stuff is cool. So let's run urine heavy metal, urine mold, urine environmental toxin. Let's run stool testing, urinary hormones, right? They're going the gamut and they're running everything. And then when people get treated, they're trying to treat it all at once. And people ultimately come in on 20 bottles of supplements. Some of them have done okay, but obviously if they're coming in and seeing me, they have not done okay and they are on overkill and they are on burnout. And then lastly, number 4, this is the functional medicine expert or the ninja. This is the individual who's been in functional medicine for a bit, and they understand that functional medicine is about understanding the underlying root causes. They also understand the importance of a evaluation and history. When you're talking to them, in their mind, they're already piecing together the pieces of your puzzle. That way, whenever they make lab recommendations, they're going to make it as targeted for you as possible. So you may get mold testing, or you may get infection testing, or you may get a stool test. But it's rare that they come out and say, hey, you know what? I just want to run these 6 specialty tests on you up front. Now, that may happen if you have Parkinson's disease, dementia, other things like that. But for most things that are coming in, that is not the case. Then when they get your results, they're going to prioritize and say, what are the main contributing factors? How does it overlap? Let's be targeted for that. They're not going to treat everything because they understand that as some areas improve through treatment, other things that haven't directly been treated will actually still improve. And then we'll actually talk about the 5th type of functional medicine provider at the end. And this is the most rare type of functional medicine providers by far. But those are the 4 main types, and that is how they differ. So if you are looking for a functional medicine provider, please go look at their websites, look at their social media, interview them before you go in. Even if you have to pay a little bit, it's worth it because you want to make sure you've got someone who truly understands the process and is going to be able to walk you through what you need. So what exactly does functional medicine treatment look like for chronic fatigue syndrome? As we talked about, there's a lot of issues that go on. We know there can be GI-based issues. So this is a brief example of 2 different individuals stool testing. Oh, guess I made a mistake and picked the same one. But, right, we look at short-chain fatty acids. So some people have low butyrate, others don't. Calprotectin, that's an inflammatory marker, right? Zonulin, secretory IgA, beta-glucuronidase. So there's a lot of things in here that give us a good idea of what's happening in the gut. There are some people who have bacteria, viruses, or parasites that have to be dealt with. And you could generically try to treat everyone with their gut issues, or you can do stool testing and be more specific. Since doing this test, I've been way more targeted. I know if I'm going after a parasite versus a bacteria versus I don't need to do any of those, and I just need to focus on certain bacteria strains. There are some people who say you have low butyrate and want to give you a butyrate supplement, but there are also bacteria. It's their job to produce butyrate. So this is kind of where we go in the hierarchy of providers, right? So if you have low butyrate production because you don't have the right bacterial composition, the functional medicine expert and ninja, if they give you butyrate, they're going to let you know, hey, this is kind of a short-term thing because we're going to get you on the right probiotics to naturally increase your body's production of butyrate. But they're also going to talk to you about making sure you get good undigestible fibers, things that can be used as prebiotics, because ultimately that is what your gut microbiome uses to make short chain fatty acids. So that's one example. Next, mold is another big thing. So mycotoxins, which are produced by molds, are a big contributor to chronic fatigue syndrome and POTS. Once again, not every single person with mold will have those issues, and not everyone with chronic fatigue syndrome will have mold issues.